Hello and good evening. I'm Dr. Arjun Kalyanpur. I'm the founder of Teleradiology Solutions, which is a Bangalore-based organization that is in the teleradiology space. And it's my pleasure to welcome you to this evening's interaction with Dr. Harsh Mahajan. Now, Harsh needs no introduction whatsoever to anyone in the radiology or medical community. He is an icon and an inspiration to radiologists and entrepreneurs alike. He is he's the honorary radiologist to the President of India, and he was awarded the Padma Shri in 2002. He's a former president of the Indian Radiology and Imaging Association, and he currently serves as vice president of the Healthcare Federation of India. He's a highly accomplished academic radiologist and a dynamic and visionary entrepreneur. It's absolutely a pleasure and a treat to be online with you tonight, this evening, Harsh, and to have this opportunity to chat.
Thank you so very much, Arjun. Thank you so very much. You've been really kind with your words. I, I'm a radiologist who likes reading scans, and that's what I try to do most of the time. Of course, as the youngsters grow, they don't want you doing that, and I struggle to get cases to study. But thank you very much.
Pleasure of mine. So the context for the conversation today, Harsh, is we're talking about the impact of COVID on the healthcare industry and where it has brought us to and what we see of the future. But I'd also like to take this opportunity to share with our viewers a little bit about your own journey as a radiologist and as an entrepreneur. I wouldn't want to lose that chance. So I'm going to actually start this interaction with a question about where it all began. And what was it that inspired you to take up medicine as a profession and then subsequently specialize as a radiologist?
Thank you, Arjun. See, I was born in Delhi and, went to the Delhi public school. There used to be only one at that time. Now we have over 100. This was on Mathura Road. And, it was very natural at that time. And I passed out in 1976, and there was no +2 at that time. We were the second last batch of 11th, the higher second batch. And, if you were good in studies, you either became a doctor or an engineer. That was how it was at that time. And so I had this thing about biology and wanting to be a doctor. And even though I was interested in, elocution, debates, I also was the captain of the Delhi School's table tennis team. But ultimately, it was all about studies at the end of the day because my parents were teachers. So you had to, and ultimately went to Maulana Azad Medical College in Delhi, did my MBBS there, and then went to PGI and did my MD radiology. And after that, as you know, I came to the All India Institute as a senior resident and got a Rotary Foundation scholarship to go abroad for a fellowship.
Okay.
And that fellowship, I was very keen on interventional radiology at that time. In fact, even at the All India Institute at that time, we did biliary drainages, we did embolizations and all of that. I'm talking 1986.
Right.
And so went to MD Anderson on this scholarship for doing an interventional radiology fellowship. And because that's a great institution, it's the largest cancer hospital in the world, and they were doing vascular interventions since the 60s. And their MRI had just come. It had come in December 1986, and I was there in July 1987, and I got fascinated with MR. And kind of, since I was paid through the scholarship, I made a request, and they said, "Okay, you can do this." And that's how the interest in MR. And then, of course, came back to India in 1988.
So I'm going to stop you there for a second because I want to know the reason. And I remember we had this conversation way back in 1991, approximately. I was a postgraduate at Ames and you were a
Yeah.
senior resident. And I remember, this is when you just shortly after you'd come back, actually. And I asked you, what was it that brought you back when you had probably a lot of great opportunities to stay on in the US? So I'm going to follow up on that question here. What made you come back and open the first MRI center in Delhi?
I'll tell you about that. It's all chance and God's will. When I came back, and why I came back, because my parents were here, and even though my wife and 1-year-old son Vidur, whom you know,
Yes,
they were
of
with
course.
me, and we had a 7-year visa, and but we decided that if we stay longer than a year, we will
Uh-huh.
develop roots, and it'll be very difficult coming back because MD Anderson was such a great hospital and they wanted me to stay on. And
Mhm.
I enjoyed it there, but then there was also a tinge of loneliness. Even though we had great friends and working environment was excellent, so we
Yes.
decided we will go back more from the parent point of view and came back. And also, another factor was that India's first MRI had got installed in 1988
Hmm.
at the
Okay.
Institute of Nuclear Medicine
In,
in
yes.
Mars. And there, I came back, there was a vacant position to come back and join there.
Right.
And one never looked beyond a job. We came from a working class family. So when I came back, you'll be surprised. It took 1 year and 9 months
Hmm.
for a vacant job of a scientist C, which is equivalent to assistant professor, in INMAS to be advertised, for the interview to be held, and for me to join ultimately. Even if
Hmm.
I'd known that 2 years down the line I'll get this job, no thought would
Right.
have entered my mind. But one didn't know. And I became rather frustrated. I came back and joined RML Hospital, again, back as a senior resident. And we did a
Okay.
lot of interventions there, but then there was
Mhm.
no MR. There was only
Right.
one MR in the country. So I started feeling I'm the only trained MRI person in the country. I'm going to forget everything. So that's when the seed, let's do something on our own, started coming. And I spoke at home, and at home they all laughed at me. This guy's gone mad. He's talking of crores. That was the time when there used to be lakhpatis. The lottery used to be 1 lakh.
Mhm.
And but you know this seed came in. Then we spoke to certain businessmen. One of them, my father's friend, got interested, and that's how the whole thing started. If I'd got a job even within 6 months, 1 year of my coming back, I wouldn't have got an MRI or set up a MRI. It was way beyond even my thinking. And then to think that we were able to set it up 2 years before All India Institute got its MRI, that was the surprising and the amazing part. So it
Well,
was
all
just
credit.
by chance, sheer chance.
Well, all credit to you, Harsh. And I have to say, you're an inspiration to many radiologists, including myself. I followed you to the US a few years later, and your words rung in my mind about, what inspired you to come back to India and start working there. And I was drawn to make that same move
Yeah,
some
so
years later and start in
you
Houston.
came back much, you developed roots and yet were able to come back, which is
Yeah.
phenomenal.
Yeah, absolutely. And I think that you've set the tone for a number of physicians and radiologists around the world to return to India. So from that one center that you started back then, today you've done Mahajan Imaging, which is a you know chain of centers all over North India, providing very high quality diagnostic services. So what is the secret sauce? What is the organization's culture that has allowed you to scale and maintain the quality? What is your priority that your team sets that you set for your team? We seem to have an interruption in Dr. Harsh Mahajan's internet. Um, so we will have to give it a minute or two until we can get him back on. But for those of you who are tuned in, who are not from the radiology profession, till we get Dr. Mahajan back, the centers that Dr. Mahajan runs are very high-end imaging centers, which are uh, focused on digital imaging, which ranges from, of course, digital radiography to mammography, ultrasound, CT scan, MRI, and even PET CT and um, radiology. This is a combination of practices based at hospitals and institutions, uh, or through private standalone diagnostic centers. Um, to tell you a little bit about teleradiology, what we do, it's a field where the images are distributed over an imaging network. And so the radiologist is at a different location from where the scan is actually acquired. So the patient is in one place getting the scan, but the radiologist is in a different location. And part of the reason why this has become so necessary and important is because we have a major shortage of radiologists in the country today and in many other parts of the world as well. So I think the interesting thing that we've seen at this time with the whole COVID pandemic has been how um, radiology has evolved and transformed in the wake of all the social distancing and restriction measures that have been necessary. And once Dr. Mahajan is back, we will be discussing this in greater detail. Within teleradiology is just one aspect of it, which allows the reporting to continue from offsite so that radiologists can work in a socially distanced kind of environment and so continue to be productive even at a time when they may be quarantined or otherwise restricted from interacting with patients. Um, the other aspect of radiology in COVID, which we will discuss with Dr. Mahajan when he's back, is to do with the use of imaging in COVID, which is related to the detection of the lung disease using X-rays and CT scans. And one of the projects that I've had the good fortune to interact with Dr. Mahajan and his team at Caring has been related to the development of an artificial intelligence algorithm developed specifically for the detection of COVID lung disease on chest X-rays. And this has been done in collaboration with the IGIB, or the Institute of Genomics and Integrative Biology in New Delhi. So radiology is at a very exciting time in its evolution. The technologies are ripe for providing new applications. There are different disease sets which we are able to diagnose even earlier. To some extent, the challenge is related to very large imaging data sets that we are faced with. A scan which 10 years ago would have been 100 images, today is 1,000 images. So we need technology to step in and solve the issues that humans cannot deal with. And that's where teleradiology plays one role by allowing the images to be brought to the radiologist, and where artificial intelligence plays a role in enhancing the quality of the radiologist's report as well as expediting the report, because the challenge that you face when there is a radiologist shortage is related to reports getting delayed more and more. So by using technologies such as AI, we can expedite the process and bring to attention the disease which is shown by the scan or the X-ray or the image, and prioritize it so that the radiologist can immediately make the diagnosis and communicate it to the clinician. So we have a interesting paradigm today of human and machine working together, and I think radiology is at the center of it. A lot of work has been going into exploring new applications for technology in healthcare, and as I'm sure you're all aware, AI is certainly at the center of this discussion. So once Dr. Mahajan is back, we'll hear from him in greater detail about his initiatives through his organizations, Mahajan Imaging and Caring. We're just waiting for him to log back on. I understand he will be back with us momentarily. Okay, so there is a question in the chat box, and I've been asked to share experiences with teleradiology. So teleradiology, in our organization, we've been practicing it for almost 20 years. We started in the beginning of the year 2002, and essentially it provides value in certain environments, and one of them is emergency situations. So in an emergency, you may not have a radiologist available in the hospital at the time when the scan is done, and teleradiology allows the images to be brought to the radiologist so that the diagnosis can be done instantly. And a lot of our work in teleradiology consists of working with hospitals in different parts of the world, including the United States. So we have a hospital in, say, Boston or Philadelphia, and the radiologist is reporting, such as myself, from Bangalore, for example. So the time difference between the hospital in the United States and the radiologist here in Bangalore or New Delhi or Hyderabad, where my colleagues are located, or Mumbai, allows us to be doing the work in the daytime, whereas the hospital it's 3 a.m. at the hospital in the US. So the day-night advantage is of great value in healthcare, and we've used that in our organization to provide high-quality reports in the emergency environment to hospitals across the globe. So it's very exciting from that perspective to be able to contribute to healthcare half a world away. The other area where teleradiology helps is in subspecialized imaging. So in certain very high-end imaging technologies, such as we mentioned, MRI or PET-CT, bringing the images to the radiologist allows one to get the most subspecialized opinion and quality report. Question from the chat box: can any radiologist do teleradiology? Does it need special software? Yes, it does. It needs a special teleradiology workflow, which is driven by a technology called DICOM, which is a type of protocol for image archival and communication. It's a digital protocol, so the imaging has to be digital, and the workflow allows the imaging to be distributed to the radiologist. We're happy to have Dr. Mahajan back with us. So
yeah, I'm sorry. The whole, now I'm joined through my phone. The entire Wi-Fi of our area is gone. Something
there must be something
major has happened. Yeah. So I'm sorry about this.
No worries.
Yeah.
I've been kind of holding forth in your absence. But,
no. Thank you so much. And yeah.
So we were talking about your organization, Mahajan Imaging, and what I would like to lead into is how you've seen your practice change with COVID, and what are the steps you had to take to deal with Corona, and how you modified your practice as a result.
See, with COVID, as you know, initially during the lockdown time, there was hardly any patients coming in. So Of course, our centers which are within hospitals, they continue to function, though with a skeletal staff,
Mm-hmm.
because there were very few patients in the hospitals as well. And most of the standalone centers were shut. Out of five of our standalone, six of our standalone centers, only one was functional. And that
Mm-hmm.
too, there was hardly any patient load. Still, for certain emergencies and for certain patients who needed a follow up scan, they were coming in, but very little.
Mm-hmm.
Uh, Early in the pandemic, we realized even when WHO was saying that mask wearing is not needed, we felt that from our own experience, we were wearing masks in any case. We
Mm-hmm.
started, giving those surgical masks to the patients as well. And you will
Mm-hmm.
be surprised how tough it was to get the mask. An N95, even if you paid 500 rupees for it, was not available. And
Mm-hmm.
surgical masks at that time, 20 rupees, I remember we paid through some contact that we were even able to get it. We were lucky that we even got them. And then, of course, the sanitizer and all of that we started. Once the opening up happened, initially we were noticing the staff, the radiologists were majorly reporting from home, except the ultrasonologists who were coming in. All the MR, CT, whatever numbers, small numbers were coming in, and very few, and then as the workload started picking up, there was also this thing of sanitizing the equipment. If you remember at that time, the underlying thing was contact, that
Yes.
contact surfaces and all that. Now we know
Mm-hmm.
that, we may have been grossly overdoing it. But at
Right.
that time, apart from, PPEs and especially for the ultrasonologists, any procedure which we did, a FNAC or a biopsy, it was our doctors, radiologists would wear PPEs, and of course the N95 masks right from the front office, even the security guards all the way down. So the
Mm-hmm.
entire way of working changed. And because not only did we have to protect ourselves, more important was protection of those who were coming into our care.
Mm-hmm.
And quite proud to say that 10 months down the line, we don't know of even a single instance where we may have imparted or given
Mm-hmm.
the infection to someone who
Mm-hmm.
came to us. And
Right.
and of course the fact that mask, if you're eating food or having tea, you have to do it in isolation. You can't be four people sitting and chatting and having food, because that once the mask is off, you are at a lot of risk. And
Right.
similarly in the hospitals, within the hospitals, what we had to do, we shifted our portable units to the ICUs, to the COVID wards.
Mm-hmm.
Where possible, we shifted our CR systems uh, out there, got additional ones also. And so things really changed. Also, since we had a genomics lab, we started doing RT-PCR testing. And what
Mm-hmm.
the learning from COVID, the pandemic, was that there was huge resilience in the entire system.
Mm-hmm.
And the thing up which we saw, see, in radiology, you won't see it, but
Mm-hmm.
in RT-PCR testing, which when the country started, we were capable of doing only about 100 tests a day. We are now
Right.
at 0.5 million tests a day. And
Right.
this ramping up in both the public as well as the private sector happened very rapidly. And so
Mm-hmm.
this shows that we are capable of meeting the challenges. And indigenous companies came up with testing kits, and it's been a huge learning experience. And today, the same N95 mask which we bought for 250 rupees at that point of time, and that too we had to beg, borrow, or steal. Today, you can get it for 25, 30 rupees. That's where it's come to. There's so much of production we are exporting these
Right.
things, including the PPEs, which not one PPE used to be manufactured in this country. So it's been a huge learning, and we've learned how to protect ourselves from
Hmm.
infection and also how to protect our patients.
Right. Yes, absolutely. I think the healthcare industry in India has pivoted and responded with strength. And I think the
Absolutely.
example of your organization is certainly inspirational in that regard. I was just telling the audience earlier about some of the work that we did in the space of developing an artificial intelligence algorithm for
Yeah,
early
yeah.
detection of COVID. So, please feel free to share your thoughts on that, on how
I
that
think,
played out. Yeah.
we have been working in the field of artificial intelligence. Caring, our research division, has been working since the last 2.5 years, doing some very original work, both from the point of view of the thought process itself, and then of creating the software, and then of implementing it. And I think even in COVID, what we learned, just as we'd learned earlier with, say, detecting nodules on a chest X-ray, or for a TB algorithm, that I wouldn't say that it's as great as 99%, which many people claimed, but it is a great tool in the hand of the radiologist, even in the hand of the chest physician. If we have an artificial intelligence algorithm which will flag out the COVID positive cases
Mhm.
automatically, it can be a big, big help. And very robust algorithms have been built around the world, as was ours, which we worked together on along with the CSIR. And I think there is no doubt that artificial intelligence will play a major role in medicine, specifically radiology and imaging. And there's this fear which radiologists have: will we get replaced by artificial intelligence? I think that fear is misplaced, at least in the short 5 to 10 year term. But one thing definitely will happen, that we will have to learn what is artificial intelligence. We will have to adapt to it. We will have to adopt it. And the radiologist with AI will definitely over time replace the radiologist without AI. That much is for sure, because productivity will be better, turnaround times will be better, you'll be more accurate, your reproducibility of your report will be that much better, and overall, it will also reduce the cost of healthcare. And we are beginning to see that if a computer can read 5,000 x-rays of the chest in 5 minutes or in 1 hour, depending on how what its capability is, that's going to help. Even if one is able to differentiate normal from abnormal, that itself can be a big help. You don't need to look at the normals, but it's still
Right.
early days. We are working on it. We are working with multiple groups around the world. There are some impediments to the acceptance of AI and to the use of AI. Not all of them are emotional, and not all of them are because of the fear that radiologists may have. But over time, these will definitely come into their own and be commonplace, really.
Thank you. And there's a question from the audience as on how you think AI can be priced for diagnostic centers. Would you like to
How AI can
can be priced?
priced.
Pricing.
See,
Yes.
that pricing will depend on the local factors. See,
Right.
there is some uh, very well. Building an AI is not a simple exercise. It requires expertise. It requires money. It requires a lot of diligence. It requires thinking. It requires, even to the, level of knowing what is needed. And so there is, and you may build a AI algorithm and nothing may come out of it. Not
True.
everyone's going to have a fantastic attempt which will be used in day to day clinical practice. But as far as pricing of AI, ultimately for the user, or for a hospital system, or for a radiology clinic, or for a
Mhm.
practitioner, a physician, it will all depend on local factors. Today, when you report on a chest X-ray in the US, you may charge anywhere between 10 to 50 US dollars. Whereas in India, when we do a CGHS chest X-ray, we get $1, and in that we give a film, we give a report, we give a folder, and all of that. So in India, probably it'll be much cheaper, much lower the price. But in the US, if from say an average of 20 US dollars, you're able to bring it down to five even, that'll be
Mhm.
acceptable there. So from that point of view, or even $1, you'll still make a lot of money, because once you have a robust algorithm that's been accepted, then
Mhm.
there's very little that you will do need to do. At least I, as a radiologist, think our engineering colleagues may differ on that. There may be need for keeping it going, improving it. Would it slip up with time? Would it change over time? These are all questions that are open. But
Right.
it'll the answer to your question, it'll depend on local factors. Just as healthcare in India is cheap, similarly, AI algorithms will be priced cheaper here. Now, whether you
Mhm.
do it on a per case basis, whether you give the algorithm over and the person buys it, I don't
Right.
think that may happen. But or it may be a per case thing, or whether you sell it to a manufacturer like a GE or a Siemens or a Philips, which puts it on its machine. All those things are still, it's still early days, but
Sure.
definitely
Yeah.
it has to lower the cost for the healthcare system. Only then it's going to get accepted. Otherwise, it will not.
Right. That's a very important message. Thank you for making that point. Couple of personal questions, if I may. So one I'd like to ask you is, you're a super achiever, you're a consummate professional, but you're also, a fun guy, you're a family man. What is what would you have been if you hadn't been a doctor? What do you think you'd have been? I'm going to tell you what I think that your answer would be, but I would like you to tell me.
If I'd not been a doctor,
Yeah, yeah,
probably my grandfather, my maternal
yeah.
grandfather, wanted me to become an IAS officer. You
Okay,
know, and maybe if I hadn't done medicine, Uh, probably I might have done that, or I might have gone into management, done an
okay,
MBA or something
okay.
like that. Um, uh, so really, but frankly, I can't think of doing anything else, And
Absolutely.
but these two are the professions I would definitely not have become an engineer,
Uh-huh.
uh, but maybe a management person or an IAS officer,
Right.
because during our time, I mean, you could only want something which was stable, which would get you salary at the end of the month.
Right.
And if God had given me a wish and said, after I did my MD, what do you want to be? It would never have been an entrepreneur. you know so God has his own ways. You take your chances as they come, and circumstances mold what you want to be, what your desires are. What I would say, you should be open to changing your desires. Don't be fixated on anything, because we, with our limited intellect, want to plan our futures, want to plan our lives whereas there's a greater force there who knows much, much better about you than you do, and who
Right.
can chart out the course of your life much, much better. So we should flow with the tide and make the best of whatever opportunity you get, because and if you look back at your class in
Hmm.
school,
Yes.
and you will find invariably that those who were the latter half of the class, as far
Mhm.
as getting as far as academic excellence went, they have probably done the best in life. So
Well, yeah.
the cliche is, you have to play with the cards that you've been dealt with,
And then, mhm.
and make the best with it. So someone I can share that I did radiology was my second choice. I wanted to do MD medicine, but there in PGI Chandigarh, I was first on the waiting list,
Okay.
and I was first in radiology in the entrance exam, and
Right.
I had some 4 or 5 seconds. At that time, for every subject, you had to write a separate entrance exam. There was no
Right.
common entrance test, and
Hmm.
there used to be, a written test. Then there was cases. Then there was viva, and it was like a final year exam.
Right.
And so I was given 5 seconds by four professors to choose between being first on waiting list in medicine or taking radiology. Luckily, I chose the right thing, and
Luckily
and
for
so
radiology.
God knows if I'd got medicine, where I would have been. So ultimately, God shapes your destiny. We have to play our own part. I-
Right.
we have to do our own job. But
Right.
so let's not be fixated on what we want to be or where we want to go.
Very true.
God generally has better plans.
Thank you. That's a very important message, I think, for all of us in healthcare and in every industry.
Yeah.
So I think we're heading into the home stretch, but there's one question I wanted to leave with the audience with you. You know, you've achieved so much as a physician, as a radiologist, as an entrepreneur, as a leader in healthcare. What is there anything that you still have left on your bucket list? Something that you still aspire to do, which haven't checked off yet in your box?
Arjun, I think, every day is a new day. And every day you want to do something exciting,
Hmm.
something which is different from what you've been doing. The humdrum of life,
Yes.
the routine stuff that you do, that is all fine. But there should be a new challenge. There should be a new, when my son Vidur came back and he formalized the research that we do. And
Right.
now we are, working in the field of artificial intelligence, also in the field of genomics. It's I at least find, if I'm doing something new, um, uh, much more interesting.
Yeah.
It keeps me happy. It keeps me engaged, and there is no boredom of the humdrum of doing the same thing over and over again. Not everyone has that, opportunity, but I think to keep evolving, I would say, is and if there's an opportunity for doing something new, I never say no. Even without knowing what is going to happen, I never say no. And at times, you feel, hey, why did I say yes to this? Now I'm facing problems, or especially when early morning you have to wake up, go for a lecture somewhere, or then you curse, that I should have said no. I'm waking up at 4 a.m. and going to the airport. But still, that is what I believe, that keeps you going, keeps you fresh, keeps you motivated, and newer challenges, and meeting newer people, new youngsters coming into the organization, bringing in newer ideas, and in them you can see also where you started from. And
Hmm.
frankly, these youngsters are much more motivated, much better educated, and definitely much more aware than what we were. We just, why one set up the second center and the third and the fourth, one never knows. At times one used to question, but these youngsters are really motivated, and I'm sure that any youngster who's seeing this program, I would say that have your ambitions, have your goals, also be ready to modify them as time goes on, because ultimately you have to deal with the circumstances the way they are coming. And and frankly, I'll say, don't envy someone else, or don't be jealous of someone else, uh, because you have your own destiny, you have your own future. And jealousy is a very negative emotion. That's the other thing. Always think positive. It's maybe a god given gift, but in any situation, however bad, somehow I'm able to see something positive, and that keeps you motivated and keeps you going. So don't feel dejected because something you wanted you couldn't get, or something you aspired for is elusive. Maybe something better is there for you to grasp.
I think that's a great message to leave the audience with, Harsh. And I have to say that you have certainly walked the talk in your glittering and illustrious career. At every stage that I've had the pleasure of um, connecting with you, I've always been inspired by your positive energy, and you certainly exude optimism and positivity. And I think that's a very important trait for all of us to have, especially after what we've gone through in the past year. I think it's a big
Absolutely.
plus. So your messages are well heeded by our audience. So I think we're basically out of time at this point. But I'd just like to say a big thank you to you for joining us this evening and participating in this interaction. It's been a real
Thank you.
pleasure for me personally, and
Thank you
I'm
very
sure our
much,
audience.
Arjun, and thank you to the organizers for inviting me and having such a brilliant moderator who's a dear friend, more like a younger brother, and who is the mentor of my children.
Oh,
Thank you very much
that's
for that as well.
absolute honor to hear you say that. Thank you so much, Harsh. Thank you very much.
Thank you. Bye bye.
Thank you. Goodbye.
Bye.